spelling. With those changes, do I have a motion to approve the minutes? Paula, second.
Carrie.
Carrie.
Yes.
Roll call, Paula,
Yes.
Carrie,
Yes.
and Rick, yes. So those minutes are approved. I do not see any members of the public.
Is Lina a member of the public?
Yes, Lena is a member of the public. She's affiliated with 166 High Street.
Okay.
So,
So they would be part of that hearing.
correct. And so is Lee Riley.
Okay,
With, part
thank
of
you.
166
And
here.
welcome to both of you.
Okay.
Thank you.
Um,
Hi, everyone.
I'm not the public, by the way. Good evening. I'm here actually representing Jennifer Yang from 166 High Street.
Good evening. Welcome.
Good evening, welcome.
In terms of 110 Main Street, I don't see any members from that store here.
And unless
Someone just joined with the name Larry. I'm not sure if they are part of 110 Main.
He's my brother, so he's also associated with 166 High Street.
Okay, so he's associated 166. So
welcome, Larry.
Thank you.
so I think that we should move on the agenda. If some members from 110 Main Street appear, we can take them a little bit later in the meeting.
We can do that, but I'm not sure their presence is, I mean, they know that it's going to be a 3-day suspension, so I'm not sure we need their presence here to be able to determine that.
Okay. Why don't we, I agree, but why don't we revisit that maybe after we get down a little bit further in the agenda before the community health needs assessment, and we can do we need to take a vote for that a day? Because the fine has been paid and the suspension is sort of mandatory based on
The regulation.
regulations that we passed last May. So I don't know if there's much discussion. The only issue in that administrative meeting, to my mind, would be as if they don't agree that there was a violation. And so let's have the updates from Maureen on tobacco control. And then if no one is present, we can kind of go back to that, just wrap up on that. So Maureen.
Right, Maureen?
Hi, everyone. Nice to see you all again.
Hi, Maureen.
I did make some notes so I could, there are actually a lot of updates, but I'll just try to go through them quickly, just so that you're aware. I won't provide much detail. I'll just let you know that one, Malden Board of Health had a public hearing on the nicotine-free generation on January 31st. It was well attended, not as many people as I thought, really not many more than we saw at the Stoneham, Melrose, or Wakefield hearings. There were people on both sides of the issue. Some retailers opposed it, a couple of trade association reps, and a lawyer representing a firm that lobbies for the tobacco industry. 2 high school students spoke in favor of the policy, as well as a family physician from CHA, the Malden Public Health Nurse, and others. The board did not vote to make a decision it was just input from the public. No decision yet. Like other boards, are waiting to hear the SJC's decision on the Brookline lawsuit. And even though we've expected it for maybe a month, still no decision from the SJC. So now there have been 4 public hearings out of my 7 communities. And if other boards vote, then we'll do those when they vote to hold a public hearing. For those of you who might have seen 60 Minutes on Sunday night, Mark Gottlieb, who's the director of the Northeastern University Public Health Advocacy Institute, who, by the way, has spoken at, I think, 3 of the 4 public hearings in this area, was interviewed on 60 Minutes on gambling addiction and the fact that the gambling industry is using the tobacco playbook in terms of hyping and appealing to youth and the celebrity advertising that they do for these online gambling platforms. It's something that I've heard concern about from schools and others. I know I'm hearing in schools that a lot of kids are using screen time during school for online gambling, even though of course they're underage, but we know people can get around those age restrictions. There was a recent Boston Globe article. In fact, it was online on Sunday, but it was in the printed version today, and I think A Day has a copy of it. And this was an article about Delta 8 and Delta 9. Those are synthetic CBD, but supposedly CBD, but we're concerned that it's really more like THC. And recently there have been some reports about some high school students who have allegedly used vaped Delta 8 and Delta 9 and had THC-like effects. Some exhibited being high, disoriented, that kind of thing. So if you get a chance, read that Boston Globe article. I think it's pretty interesting. I've mentioned nicotine pouches to you in the past. I've been very concerned about nicotine pouches in the last couple of years. I showed, or actually A Day showed you some pictures last time. And these 3 photos I took in a store, actually Speedway gas station mini mart on Cambridge Street in Cambridge. So, I mean, in Winchester. So it didn't happen to be Reading, but I was doing inspections in Winchester last week. And when I stand behind the counter, examining, everything behind the counter, in front of me is a complete, full shelf of Zyn pouches. To my right, under the window, another collection of Zyn pouches, and then the power wall behind me. So that the power wall is what the customer faces and sees. And again, a lot of Zyn pouches. As I mentioned in a previous meeting, Zyn has taken over chewing tobacco, certainly, but also other tobacco products as well. And I said to the store clerk, wow, seeing that much right in the counter area, I said, and they have a wonderful storage area, so they wouldn't need that much in that area unless they're going through them so quickly. I said, wow, you're selling a lot of Zyn? And he said, so much. And I said, who's buying it? Young adults. He said, boys, girls, old, young, everyone. So it's concerning. And then right after I sent A Day the photos, there was I have a Google alert for tobacco products. And there's an article in I can't remember what publication it was about, I think it was one of our local news stations, maybe Channel 7, WHDH maybe, talking about the concern in the rise of Zyn use. Again, it's a product that it's not tobacco, it's nicotine, high nicotine content, low price, made with nicotine salt, so a quick hit to the brain. And I'm concerned because it's not even taxed by, there's no excise tax on it. It's so new. Our state DOR, Department of Revenue, hasn't even gotten around to assessing of an excise tax, which means when DOR agents go into the store, and they go into stores, they're not even looking at it because it doesn't have an excise tax, so it's not on their list of products to look at. Also, I saw a recent article about psychedelic mushroom use on the rise, and I haven't seen many in our area, but I have seen psychedelic mushrooms in some of our vape shops. You don't happen to have a vape shop in Reading. At the MMA conference a couple of weeks ago, I had a chance to speak to someone from DEP about disposal of hazardous waste, because nicotine is a hazardous waste, it's a poison, and all parts of the vape device are hazardous waste. They're concerned, but there aren't any programs yet in place for ways in which we could easily help the public dispose of these. So they're throwing them into the trash, or littering parks and playgrounds or whatever. But the lithium battery, the metals that are used in the vape pen, and of course the liquid nicotine are all of concern. I had a chance to speak to someone from MDAR, Massachusetts Department of Agricultural Resources. They are the agency that would be regulating CBD products, but they don't seem to have agents out in the field that are actually looking in stores and other retail places where CBD products are sold. And they, and in fact, what I learned is MDAR has not moved people back into offices. They're all working remotely, which is why I never get an answer to any call that I make to an MDAR number that I find online. I had a chance to talk to a CCC, Cannabis Control Commission rep, about THC infused drinks. I think I mentioned that to you, or maybe those are so new that I didn't even mention last time we met. But THC seltzers, so seltzer, cans of seltzer, people like to drink. In fact, a lot of people drink it instead of water. Now you can buy those with THC in them. And they're in our local liquor stores. And then also Medford CCC, I should say, recently licensed, they call it a package store on Mystic Ave in Medford that will sell THC infused drinks. The industry is quite proud of that, and they gave space to the Medford Arts Council in their same building because there's so much synergy between cannabis use and the arts. And lastly, the White House has still delayed signing the menthol cigarette ban and the flavored cigar ban. So I'm sure that's a political movement, wouldn't be popular right now in certain arenas in an election year. So that's very quickly some of my updates. I'd be happy to answer any questions, and I'd be happy to provide more background information on any of these topic areas. Any questions?
Any questions for Maureen? Kevin, yes.
Hi, Maureen. Always good to see you.
Thanks. You too.
The one thing that just jumped out at me, and I appreciate the full report, the seltzers, they're selling these in liquor stores, not in facilities that are designed to handle these?
Correct. It was quite shocking to us, and it does seem to be kind of a loophole. In fact, there was a big Instagram push maybe a month or so ago because Cheech and Chong, some of us remember Cheech and Chong.
Sure.
Cheech and Chong came to Liquor Junction in Reading for a big promo for THC.
Heard about that.
Yeah.
Yeah. So I don't think it's right. That's why I tried to talk to somebody about CCC about it. They said, nope, it's a food, therefore it comes under the food code. And it's one of those things, like, it seems like everybody's pointing to someone else for, whoever should be regulating it or enforcing any regulations that might already be in place. It's not a tobacco product. So I can't do anything about it. And it just kind of now feels like it's one of those ships that sailed. It got away from us. If there's a licensed package store devoted to selling this, then I think it's pretty far gone. But it doesn't mean we shouldn't be watchful and that we shouldn't do education around it, that we need to learn more about how much THC, that kind of thing,
right,
and provide advice to schools and parents and all of that.
So are these hard seltzers on top of it, or just
No, there's seltzer water. Yeah,
Okay.
not so. In fact, I asked. It wasn't the Liquor Junction in Reading, but in another Liquor Junction, I said, "Are these age restricted? It's not alcohol, right?
Right.
And it's not CCC that falls under a restriction where it has to be sold in a medical marijuana dispensary. So is it age restricted? He said, not really. We're just doing that. So they were doing a voluntary age restriction, but it's not age restricted as far as I know.
No, I thought we had to be 21 or escorted by an adult in a liquor store.
Nope.
No.
Alcohol, to purchase alcohol, you have to be 21, but an alcohol, wine store,
Walking around,
whatever,
sure.
it's, and anyone can go into it. It's what we call a family-friendly store. Anyone can go in, And if a teenager went in and bought a bag, you know, tried to buy a bag of chips, they would be able to buy a bag of chips. They wouldn't be able to buy a 6-pack of beer, well, hopefully, but yeah, they could buy a product in that store. Whereas in an official adult-only store, vape shop, tobacconist, smoke shop, they aren't even allowed in. I'd prefer that they weren't allowed in the liquor stores as well, but they are.
Okay. Well, that's interesting to hear about. Thank you.
You're welcome.
Maureen, can I ask, those nicotine packets, the Zyn packets you talked about, are they not covered under our tobacco regulations as nicotine?
They are.
Okay, so,
Because it's a nicotine product, it's covered under your local regs, because the definition for tobacco includes nicotine delivery products, and it's covered under the state law, so no flavored products. It's just DOR is behind us
oh,
in
okay,
terms of recognizing it as a nicotine product and assessing, just like they were behind on vapes. It took them a few years, several years, to assess an excise tax on vapes. That only happened in 2020, that vapes
Right.
got an excise tax. So I'm hoping, because once there's an excise tax, the price will go up somewhat.
but I thought that you had said that when you asked who's buying these, the retailer said, young, old, kids. Well, if it's a nicotine delivery system, kids under 21,
Right, correct,
right, okay.
correct.
Just as
And
long as
yeah,
we're-
you are correct. They have to be 21 to buy legally. Have youth that I've sent into stores been able to buy Zyn? Yes,
and that's considered a violation.
yes, absolutely.
Okay, good. Any other questions for Maureen? Appreciate your
Thank you.
coming. And in terms of 110 Main Street, you know, there was a violation on January 6th. They've paid their $1,000 fine for the first violation, and they will be suspended in their permit for 3 days per our regulation. Ade, do you need anything more from the board with respect to that? And we can move on.
I know I would need the dates when the suspension
Oh,
starts,
okay.
because then I'll go and check the store when they're supposed to remove everything from their shelves. So if you let me know the effective date of the suspension, then I'll check on the store.
Okay. Ade, is that something you can work with, or do you need us to give you specific dates?
I'm open to the board giving us specific dates. If not, then I can work with Maureen to figure out dates.
What was the date of the violation, or more specifically, what day of the week?
I think it was a Sunday. It was January 6th. And I
Yeah.
think that might have been a Sunday.
Saturday.
Or Saturday, sorry. Saturday.
You know, I mean, it's kind of moot. I mean, we can pick, I think we need to give them enough time to prepare and to move their tobacco products off site. You know, February 12th to the 14th. Sound okay?
I believe that's a little bit too early because I have to send a letter to
Okay,
them notifying them that, you know, they can't sell tobacco and nicotine products during a certain period of time. So I don't think that's enough time to notify them.
okay, so how about in 2 weeks, February 22nd to the 24th?
Do we want to do it during a vacation week where people may not be around? I don't mean to be more penal to the organization, but typically in the past, we have used the dates to either be more or less penal, depending on the violation. But usually, you know, it's been standard to use the day of the violation as part of it, right? So, you know, to be fair, there's, you know, Maureen, I'm sure could speak to when are higher sales dates and lower sales days for a typical place. But I would stay out of the vacation week personally.
All right. You know, I don't have a strong feeling about this. Pick another 3 days. 26th to the 28th. How's that?
Sounds good.
Okay, let's go with that a day. Carrie?
I have a process question. We posted an administrative hearing. Were we supposed to open, are we in a hearing now or?
We are not in a hearing because
Okay,
they did
just
not
want-
show up. But we will be shortly on High
Okay.
Street.
So, but do we still have to, if they're, again, process, do we still have to hold the hearing and note that they didn't come? Or is their absence sufficient to say we don't hold the hearing? That's my
Good point.
question. I don't know. It's just
Yeah.
my question.
I don't know either. I assume that if they didn't show up, then you know, they've decided de facto that they do not want to have a hearing.
Mhm.
Because the letter that Aday sent said, if you are grieved by this, you know, you can come on February 8th and
Yep.
have a hearing. So
Yep. So
No,
then.
don't hold me to this, but I would read it as a public hearing is much different than an administrative hearing. Where a public hearing, you need to make sure, you know, you need to post, it's going to be in the paper, all this kind of stuff. And then you do need to open it, have public comment, close public comment, and like the whole process. I read administrative hearing as if the board wants to do something else, if they want to suspend their license for longer, if they want to, you know, whatever they might want to do, then they have the ability to do so based on that. So rather than saying we're taking a vote, because we don't have to take a vote, you don't have to vote on anything tonight. So again, don't hold me to it, but I read it as we're just doing this in-house, and if we so choose to, you know, be more penal, you know, we've had a hearing posted as such that people can show up for to try to dispute that.
okay.
I maybe we can follow, just to clarify.
Yeah,
with
you know-
MASC on that, because what I was taught is that this is a quasi judicial practice and that there are standards that we need to follow
Right.
because it's quasi judicial, including, you know, setting the time, opening, closing and the like. So I if I'm wrong, that's great. So I'd love to know. I mean,
So I would ask Aday, can you confer with town council and give us an update on that in follow-up?
Absolutely.
And if they say, no, you needed to have an administrative hearing, we can call a brief meeting and have one and close it.
Yeah, or just address it at the next meeting too. Yeah, either or.
Yeah, we could address that at the next meeting as well. Okay. So I look forward to that follow-up Aday. So now we are going to have an administrative hearing regarding the situation at 166 High Street.
I'll say good night, everyone.
Oh, good
Well,
night.
thank you,
Thanks
Maureen.
again.
Have a
Thanks,
good
Maureen.
night.
Night.
Thank you.
thank you.
And so do I have a motion to open an administrative hearing?
So moved.
Okay, Paula,
Second.
Carrie second, roll call, Paula,
Yes.
Carrie,
Yes.
Rick, yes. So this administrative hearing is now open. I'm going to turn it over to Aday to sort of give the background of this current situation. And then we will allow any of the representatives from 166 High Street to speak about any concerns or requests they have. And then we'll close the meeting. We'll go from there. So Aday, you want to give some background?
All right. Thank you very much, Dr. Lopez. I am pleased to report that as of yesterday, February 7th, 2024, the owners of 166 High Street are in full compliance with the cease and desist order dated January 24th, 2024. All animals have been removed. Cages and coops have been dismantled. The coops that were too heavy to be moved have been boarded up. All materials associated with keeping of animals, birds on the property have been removed. As a result, I do not recommend any further action or any further legal action regarding this issue. I would also recommend that the board deem this case closed. The owners have been advised that in the future, they may ask the board to lift the keeping of animals ban on their premises and secure a keeping of animals permit before engaging in the act. I'll pass it over to Dr. Lopez.
Okay, thank you, Aday. Well, that's very good news. This situation's been going on for quite a while, since late last summer into the fall. And I'm glad to hear that the residents have complied and we do not need to pursue this further. I would ask whether anyone representing 166 High Street would want to make any comments or ask any questions, and please do. Lee?
Yes,
Sure.
thank you. My name's Leigh Riley. I'm an attorney. My law firm is Riley Chan Law, PLLC, located in Newton, Massachusetts. I was approached by owner Yifang Yang about a week ago regarding this hearing. I was not aware what happened yesterday and the inspection until I guess yesterday evening. What I had originally planned was to ask the board to lift that cease and desist order so that the owner may proceed with their application for permit to keep the animals under the regulation of under six birds, because as I understood from talking to her that she had been in compliance with the order and as of the January 8th inspection. But I understand there was some issue. I also read the email just yesterday. Very appreciate town clerk's hard work to send me those documents in a very short notice, like 24 hours. So I was able to read the email. I understand the town had gone through some difficulties with regarding this particular application, the neighbor's complaint, and the violation of the ordinance. So I'm here today then, since that particular issue of cease disease has been closed. So basically I'm here, I want to give the board a little background, but the purpose of this is to, one is to set record straight, secondly, to request that that I don't know if they need to apply for a new permit because the last permit was open until the January 8th inspection issue, but I'm requesting on behalf of the owner on 166 High Street, basically to obtain the permit and then raising the chicken and ducks according to the town order. She's right now crystal clear about the strict compliance with the town order, but I want to give a little background about what have happened. So I have known Jennifer Yang, Yifang Yang, for quite a few years. She was quite active in our local Chinese community. I've not always known her. I had a personal contact with her, had dinner with her, in fact, last year. And at that time, she brought up about some chicken issue, rooster, that they have to kill that rooster. And her husband was killing it and she was hiding from that.
Sorry, I think, yeah, so just wanted to update you. I think after yesterday and with the work we've done with Ade, like you said, we are very clear for next steps. So I think, you know, now that the cease and desist is resolved, like Ade said, we'll just take the next month to work with him and just understand the, you know, all the steps, and then we should be all set for the next meeting. So I think the cease and desist, you know, like we said, it's already resolved. So,
right.
you know,
Okay. I understand that. So, but what about the pending application she had before? Will she needs to apply for a new one, or can that application be looked upon right now and get approved? She already paid the fee, and there was never a deny really issued about that application. In fact, on January 8th, she already in compliance, but she wouldn't let the inspector take a look in the basement, in the garage, and that resolved the cease and desist. It's not because any incompliance had been found, but because her unwillingness to give that access. And if I submitted the phone record she gave to me through email to town clerk. I'm not sure the board has it or not. So at the time, she was provided with the inspector's phone number, and she was told if she changed her mind that day and then allow them to come back to inspect, and they will do that. So she did a call, and then they showed the record. She actually made a phone call twice to the town inspector, but I guess it wasn't connected or somehow. So consider that she was in compliance at the time, but there's some misunderstanding and issue. So now the question we have is that based on this information that the board may not have before, and considering that she now, even though I was going to ask the board to lift that cease and desist, and then she nevertheless just followed that cease and desist letter and removed everything. To be honest, those chicken and ducks are now in foster care. They're her babies, and I know she's always been a very loving, tender person. And if there had been some non-compliance, I know for sure it's out of her. She just loved animals so much. She grew up helping grandma raising chicken, and when she was gifted with a couple chicken, and she raised them, and she just couldn't bear to, I guess, see them getting killed, and it's hard to give away sometimes. So there had been some issue that she was quite distraught when talking about the rooster situation, and I didn't pay too much attention because we were talking about other things. When she came to me, I asked her for help, and I said, "Do you really seriously want to pay me to represent you, and you need to comply with the town ordinance?" And but she really want to be able to raise a chicken, because right now it's almost like take her baby to foster care right now. So she would like to get that 6 chicken and ducks back as soon as possible. I know she really loved those animals, and she loves people too. So I didn't understand that she would have this issue. So I really feel for her, and therefore I want to be here to present this to the board. And if maybe we can give a little more speedy approval of her license, so she can lawfully raise those animals according to the town rules.
You're on mute, Dr. Lopez.
Oh no, I guess I kind of finished it. So, but the point is that the cease and desist letter would not have been necessary if not for the misunderstanding regarding January 8th. She was in compliance at the point, and she did try to call the inspector back to look into the basement and the garage. She just was concerned about her privacy and other issue. So she was actually in compliance at the January 8th inspection. So if that fact had been reviewed or proven, then there wouldn't have been cease and desist letter. I would imagine that maybe there will be 2 more inspection, and then she would get her approval. So now we are where we are right now. The cease and desist letter has been complied by the owner, and the pending application still on file. So we just want to be clear and understanding where is the town's position right now regarding her pending application. I heard about this working there maybe a month. Is that, you know, like, let's say, how long does it take? What does it take for her application to be approved at this point? And when can she start to keep animals? She has 6 chicken, 3 chicken and 3 ducks right now.
Can I
So,
just jump in real quick, Dr. Lopez?
sure, go ahead.
So we have a pending application that wasn't paid for, and that
Oh.
was pretty much denied. So what we did was, you know, we've been trying to work with her since July. You know, we're hoping that hopefully, you know, everything will be taken care of, and then she would pay for the permit, and then we'll issue the permit. But it never happened. And now that we have a cease and desist, there can't be any animals on the property at this point. There's a ban on keeping of animals on that property. So the process will be to come to the board, ask the board to lift that ban, and then she will turn in a new application, follow the instructions, give us a site plan, send pictures of the cages and things she's going to be using. The application would be approved. We will issue a permit, and then she can start putting cages up according to the plans that she provided.
Well, thank you for the clarification. So as far as I know, she didn't seem to have been notified that the payment was not received, and that was the issue. Maybe
The
I
payment
missed
wasn't
something.
the issue.
Okay, the payment wasn't the issue, so was not because of the payment. But so I am here then asking to lift this ban on her. But the reason is that the ban would not have been necessary if the inspection was able to complete on January 8th. And it wasn't complete because at the time she was not allowing the inspector to look into the garage and basement, even though there was no animal there. And she did call back on that day. I have the record. I'm not sure if board has it or not. If not, I can resubmit to the proper address. So she did a call back as instructed, basically to say, yes, she's willing to have give the full access. She was concerned about number of privacy issue. Would the photo be taken because photo had been taken before on the property, and then the maybe the danger of her storage, random stuff. So seems to me then it is little misunderstanding, miscommunication, out of no fault of the town, is her misunderstanding. But nevertheless, should that inspection had been completed and everything will be moving along and there wouldn't be a ban. So as a result, there's a ban. I'm asking the ban to be lifted, and also I tried to give a little background about the past issue. She was not, I read the email. I guess there was a calling into question about her honesty, but I'm here saying this not as her attorney, but as someone who I know her for years. And I know she's extremely loving people, and she was giving a lot of her time to services, including teaching in the weekend school and organizing various social activities. And from our conversation, personal conversation last year, which had nothing to do with this, she didn't know this would have happened. I could tell that how much she, she has such a soft heart for those animals. So when she got that, she just couldn't bear to part from them. And when she told me actually just last week, and it really was touching to me because those little chicken duck cuties. Yeah.
Maybe we can stop at this point. So there's an ask that the ban be lifted. I think we need to discuss that as a board. And are there any other individuals who were here that want to make any comments. Otherwise, I think I would close the hearing. And we can talk about whether we want to discuss this tonight or at a future meeting. So Lena, Larry, any other comments? If not,
Pauline,
This is Lena. Just thank you everyone for all the time and for the discussion, and also really appreciate Ade and the team members that came yesterday, and we were able to do the walkthrough. And I just wanted to add that, again, I think we've alluded to, there's been a communication breakdown on my mom's side. So I am now helping, going forward, to personally help be responsible, just to understand all the regulations and translate that to her, and also help implement them. So just like how we were able to get the, property appropriately, rectified for the cease and desist, and in working with Ade on that. So I think, going forward, I can also help be that bridge in terms of the communication, and then just, appreciate the board's time and look forward to the next meeting to discuss those next steps. So really appreciate it. Thank you.
thank you.
Well, may I add something?
You may,
So that's-
please be
okay.
brief.
Yeah,
'cause we need to move on.
so be brief is that, so going back to the ban issue, since the last action taken before the letter was, the cease and desist letter was issued, was the January 8th inspection. So that inspection alone should not be the ground to issue cease and desist. Even though there was a number of violation issues prior, but nevertheless, based on the most recent, the prior board decision, on January 8th, inspection was conducted and found no violation at the time. So, so on this alone, that since it seems that all the prior issues shouldn't be the deciding factor on the cease and desist anymore. As I said, should that January 8th inspection had been completed, then there wouldn't be a cease and desist letter. And there was no non-compliance was found at that time. And I would submit the phone record, calling record from Ms. Yang, they're showing that she did a call and try to get the inspection completed at the time.
Okay, thank you.
So
Thank you. I appreciate it.
Yeah.
So I'm going to ask for a motion to close the administrative hearing. Carrie, you're on mute. You're on mute. You're on mute.
Of course I am. Sorry, Rick. I move to close the administrative hearing.
Oh, before you do that, folks,
Yeah,
are you closing the
Yeah.
public portion of the administrative hearing?
Yes.
If you close the hearing, then you're not taking a vote on it.
No,
Right.
No, we are
No.
going to deliberate subsequent to the
deliberate
hearing.
after.
Yes.
The hearing closes, deliberation occurs after the
Okay.
hearing is closed. Yep.
And
May I ask,
I
what
move
is the
to
time
close-
frame of the decision will be rendered?
I move to close the hearing for the matter at hand regarding the cease and desist order.
are we clear that the public comment is completed at this point?
I mean, I'm asking for a lifting.
Lee, I was
And
asking
we're not
Dr.
going
Lopez.
to give a decision at this time.
Right.
We are going to close the meeting, close the administrative meeting. We will have a conversation and decide whether we want to lift the ban at this meeting, or we want to consider or deliberate further or think more about it and consider it at the next meeting. So roll call, Carrie?
Sorry, there was no second on my motion.
Yeah, Paula second.
No, I
Oh.
didn't.
Oh,
No,
I'm
I
sorry.
didn't.
let you
I
go.
was asking if we've heard from all the public that wanted to comment,
Right, and I've
because I
asked-
see other.
I've
Okay,
asked
oh
everybody,
yeah, I want to clear, so what is the time frame?
Lee,
in
that was
case?
directed to Dr. Lopez. Please, can let him answer.
I have asked
Okay.
everyone on the call in the virtual meeting here, whether or not there were any other comments besides those of Lee Riley. And Lena commented, I haven't heard from Larry or Jennifer, and so that's why I called to close the meeting.
Okay,
Well,
So,
can we find
Paula,
out, I'm sorry, because I speak on behalf of Jennifer and Larry. So what is the time frame we're expecting in terms of the decision on
you don't seem to understand that we are going to make a decision about the time frame after the meeting is closed. The way an administrative hearing works is there's comment about what the situation is, there's feedback from the individuals involved. The hearing is then closed, and the board will discuss your question about the ban after the meeting is closed, possibly at this meeting, but a decision might not be made till next meeting. That is the way an administrative hearing works. Paula, do I have a second?
yes,
Okay, roll call. Carrie,
Yes.
Paula,
yes.
Rick, yes. So the administrative hearing is closed. Thank you all for participating. And we can now, amongst the board, and Cassidy, I think we need to mute the attendees otherwise. Do we want to go ahead and take a vote to lift the ban, or do we want to consider it at our next meeting? My own personal feeling, and then I'll give it to Kevin, is that this matter has gone on for quite a while. I think there could be disputes about what happened on January 8th. But certainly there were problems before then. And I think we need to, my own personal feeling is we need to let the dust settle a little bit, and then allow the gangs to reapply and get a permit and so forth. I don't think it's excessive, but I'm just feeling like it took a cease and desist order to actually have compliance around this. And I think we need to, as I said, let the dust settle. And as I recall, at the January 8th meeting, although no chickens, I think, were found because the inspector wasn't allowed to go into all the locations, there was still issues around poultry feces across the yard. There was still these cramped locations where the birds were kept. So there were still issues there. The fact that she called back later and said, now you can come, raises some questions for me. That isn't exactly how inspection should go. But Kevin, I think you had your hand raised.
Yeah, I have just a few questions. So our regs are, you can have 6 poultry, correct?
Right.
So I just want to make sure that, they understand that it sounded like there were 6 chickens and 3 ducks. Is the ducks exempt from the term poultry?
No.
Okay. So I just want to make sure that the soon-to-be applicant understands that 9 is not going to be acceptable. 9 is not going to be a compliance, right? So you're going to have 6. So that's the first thing. The second thing, Lee, I understand what you were saying about the January 8th. I was not on that call. I was not involved with that. I do know there were several violations before that, and we can't go on hypotheticals. We can only go on what we have in front of us. Had the inspection occurred that day, we don't know how it would have turned out, but that's why we do the spot inspections. And I agree with the chair that we can't have the applicant schedule an inspection. It's just simply not the way it's going to be able to work. And this is not to be unfair to the folks. We want them to be able to have their 6 chickens and and enjoy it. That's why we have the regulation in the first place. That's why we allow them in the first place. So, you know, that's not the meaning of all this, but there has to be a level of compliance, and that compliance comes from the town to the residents, not from the residents to the town, if that makes sense to everybody, the way it has to just work structurally to make sure everybody's doing it the way it's supposed to be done. The question I have is, from a procedural standpoint, a day, do we actually need to lift a cease and desist? Isn't a signed off on license the same effect? I'm not sure if it's one and the same.
You have to lift the ban, the property.
You have to lift it and then they have to apply.
Correct.
Okay, all right. I wasn't sure how it worked. Okay.
Other comments, Paula or Carrie? No. Carrie?
I'll just concur and say that, you know, I'm certainly sympathetic to the idea that someone might have been concerned about having an inspector come, but it wasn't the first time the inspectors had come to the residence. We've heard about a few visits, so it was not unknown folks. And I mean, for us, for our regulations, you know, the non-compliance, you know, not allowing an inspection is the same as not being in compliance. We can't say that you are or you aren't. So, you know, sympathetic, but we have to follow our regs. And I thank everyone for, you know, their effort to try and sort this out and come to some resolution for it. It has been a lot of effort and confusion, I think, for an awful lot of folks. And I'm glad that we're getting some voices together and some assistance for everyone. Thanks.
So I would suggest that we defer this matter to our next meeting on March 14th and bring up the question of the ban at that time, and go from there.
If that's a motion, I second it.
Paula?
Yes,
I guess that's a motion.
Yes,
Roll call. Paula?
yes.
Carrie?
yes.
Rick, yes. Thank you again. I appreciate it. I appreciate your comments. I'm glad the matter was able to be resolved, and hopefully we can move ahead this spring and meet the needs of the Yangs as well as the needs of the residents of Reading. Okay, so let's move on to community health needs assessment. So we had a planning meeting, and I think all the board. Yes, Kevin.
Sorry, if I may, you may just want to remind the folks that while they're welcome to stay at our meeting for the rest of it, they are not obligated to. The portion that they were part of is over, and we don't blame you if you don't want to stay for the rest of the meeting and you want to just leave the Board of Health to us.
Right. No,
Nothing else pertaining. Thanks for coming.
Thank you so much for your time. Thank you. Appreciate it.
thank you.
Thank you.
Everybody should do that.
Thank you so much. Really appreciate your guys' help.
Thanks, Kevin. Appreciate that. I just wanted to sort of let the board know where we are with respect to the community health needs assessment. So we had a planning meeting back at the end of January. I think everyone was there except Jerry. And we had a good discussion and a draft of the document of the community health needs assessment. Subsequently, a day, Jamie and myself met to think more about next steps. And one of the concerns that I had was that, you know, we've done this assessment the best we could, and everybody has kind of pointed out, you know, the data is limited. It's hard to get perfect data in adequate numbers, but there's a lot of qualitative data with the interviews and focus groups and comments on the survey. We've come up with these 5 goals, and my concern was that as I thought about it, was that, you know, part of this is about engaging the community agencies, town management, about working with us and working together as a collaborative to address these 5 issues. And I was thinking that if we just lay it out there, these are the 5 areas we think we need to work on, it may feel like, you know, in our partners, for our potential partners, that they weren't given an opportunity not to revise them, because we're not, you know, we're not going to go over and do the whole thing. And no one has the, no one has the right to then suddenly say, but I need a 6th one about this or that. It's not about that. It's really about, you know, this is what we've come up with in this independent assessment. You know, what do you think? Does this meet your goals? What resources you think you might need, or do you think there's opportunities here? And do a little bit of processing before we kind of move ahead with the community health improvement plan. And so as a result, what we asked Jamie to do was to meet either in a group or in individual meetings with a number of the entities, the leaders of the entities that we would need to collaborate with in order to get some of this work done. And that includes Elder and Human Service, the Veterans Services, Community Development, Economic Development, the Food Pantry, and I think those were the main. There was, and of course the coalition. So there was about 4 or 5 key people. And so one outcome was that Jamie is going to be meeting with these folks, giving them a summary of the community health needs assessment, asking, you know, for their you know, thoughts on this, and try to get them to feel like they were you know, even part of the process in a significant way. And then we would hold a planning meeting in the end of February, where Jamie would give us their comments, these leaders in the community, about their comments about what they thought about these 5 goals. And at that meeting, we would get that feedback, we'll finalize the community health needs assessment, and we'll discuss what Jamie envisions as a CHIP planning meeting in March. And so that's kind of where we are. We also suggested a couple things. One was to revise, somehow word the 5 areas or goals in a way that would be clear to the layperson about what it is. Because as I read those goals, you know, there's a lot of public health speak there that we all sort of understand, but the average person, the average select board person, you don't necessarily, you know, may not, what do you mean by this? So we asked Jamie to go back and try to word those in a way, and we'll talk about this at the planning meeting, word those in a way that, you know, not only the people in the town government, but really out in the community. Because part of what we're also going to need to do, you know, when we finalize the community health needs assessment, which will have those 5 goals at its conclusion, is to get this information out to the public, that this work has been done, and that this is what we perceive as the needs over the next 1 to 3 years. And so you want those goals to be worded in a way that is understandable. And so that's kind of where we are. And I don't know, any thoughts or comments we can pass on?
Nice work, you guys.
Oh,
Thank
thank you.
I mean, I think that that's really smart, and I think that, you know, the opportunity to hear from our partners and collaborators and let them have a opportunity to kind of validate or question or, you know, just show maybe where there are areas of
Hmm.
synergy or where there's variation. I mean, it's all just good information, and I think it's a really good strategy for helping us move forward with this.
Yeah, it'll help validate a
Yeah.
lot of what we, validate a lot of the data.
Right.
Yeah.
I mean, and as you said, Rick, we're not asking them to come up with new ones. We're not saying we want to have anything redone. It's not that. It's just kind of a, we've gone through this process. We don't know what processes you have gone through or not gone through, but here's what we've gone through and here's what we've arrived at. And, you know, you get to think about it before it gets kind of announced. I think that's very fair. So that's great.
Good.
And I love the, sorry, Rick, I'm sorry, I'm
Sure,
interrupting.
go ahead.
Just the plain language, the you know, the
Mhm.
addition, using the
Yep.
plain language, really, really important, you know, really agree very much
Agreed.
that
Yeah.
we want these to be clear and useful for everyone. So that, you know, hopefully they'll continue to buy in and help or link up with us or.
Absolutely, absolutely. Because you know, you look at those goals as written currently, and if they appeared in the Reading Post or whatever, you know, or patch, you know, people might scratch their heads. And
Yes.
So the thing that I liked, what you just said, Rick, was that she's going to go back and discuss these goals specifically with, you know, department heads, community folks that are kind of the, lack of a better term, called boots on the ground, that really understand exactly what is happening, what really is going on in Reading. When this whole process started, that was always my fear, is to make sure that we're actually getting good information back in regards to what the average resident in Reading is going to need as far as services or otherwise. And so that, you know, I know we had discussion about the survey before. I wasn't crazy about the amount of buy-in for the survey. I'm never crazy about the amount of buy-in when it's not less than 100%. So I'm not a good judge in that regard. But it was obviously, you know, it was fairly low in my understanding of, if it's going to be a low result, it should be a low factor, right? So we don't use this survey as a high factor in what we do because we had a low result. I'd rather use the department heads as a high factor in what really it looks like to be healthy Reading out there. So the fact that she's going back and she's going to discuss these things with them makes me pretty happy, because I think that's where ultimately you're going to get a better plan in the long run.
Great. Yes,
May
Kate.
I, Rick? Sorry. It just occurred to me as Kevin was talking. I think that it's great that I think Jamie getting some time to do that, because one of the things we know we encounter often is kind of a different understandings of what public health is and what public health, you know, interventions or, you know, whatever, that's a fancy word, but you know, what public health work's supposed to be kind of focusing on. And I think that, again, that conversation with Jamie will hopefully be very informative for folks as well. And we can manage some expectations of what makes sense for public health to be able to do,
Absolutely.
what is really more of a direct service thing that's outside of our scope or whatever. So yeah, I mean, I just think that's really, it's a great outcome, I think. Really smart.
And my hope is that each of these, as human health services partners, as Ade would say, each of these might see in their own sphere an opportunity, you know. So if you look about, let's say you talk about substance abuse, you know, the veterans might see that there's an issue with substance abuse in veterans, and how can we address it? Obviously, you know, in the schools and the coalition, or about, you know, isolation and loneliness, not only senior citizens, but, you know, again, veterans and, or the recreation department seeing that there's an opportunity that they could do something to help. So I think each one would look through their own kind of
Mhm.
sphere about how this would
Freelance,
relate to
yeah.
them.
Yep.
Yes, and it would be so beautiful if they could use this as info that kind of helps
Yes,
inform their own programming, you know, and yeah, it just, because a day and, I mean, a day and his team are fabulous, but they certainly can't, nobody can do any of this stuff alone.
all three of them, they can do it.
It's only 25,000 residents, come on.
Yeah. But yeah, I mean, we can offer a lens, and then, yeah, trying to help other folks think about it, and how do we partner, and how do things they do maybe address that. I think
Yes,
it's a really great collaborative opportunity.
Definitely.
okay, good. So a day, monthly report.
All right, Cassidy, Vision 2020. So, we did this last year. We're doing it again this year. It was very popular. People want it back, so we're gonna do it again.
Great.
So we will be hosting a vision clinic in conjunction with 2020 Onsite to deliver on-site eye care to our residents and employees. The last time we had it just for town employees, but because we got like a great feedback, we're opening it up to everybody. So residents, employees, anybody that wants to come, go ahead. So each comprehensive eye exam includes a high definition retinal scan, a near vision test, a vision chart, and a private consultation with the doctor. The clinic will take place on March 25th, 2024 in the town hall parking lot from 8 a.m. to 4 p.m. Let's see, the company accepts all major health and vision insurance plans. They'll take care of all the paperwork. We don't have to do that. So that's a good thing. You know, I encourage the residents and town employees to use their flexible spending account dollars, and also their wellness account dollars. You know, I mean, yes, they're still paying. It's a form of payment, but it's not directly out of pocket. So, you know, they can do that. Can you put up the next flyer, please?
Yes, Carrie.
And Paula had her finger up first.
Oh, sorry.
No,
Just
no,
put-
no, it's on. I'm sharing.
Do you know if they're going to do tests for glaucoma or macular degeneration or those kinds of things?
Everything is included.
Okay,
Everything
Great.
is included.
that's awesome. Fantastic.
Is it, so it's, you said, use the word doctor. Does that mean there's an optometrist who does the
Correct.
test?
Yes, there's an eye doctor.
Yeah.
I don't want to be too fancy, but there's an eye doctor on site.
Okay.
And it's a
And,
real doctor.
Yes.
Okay.
So yeah, the registration link is on our website. Feel free to go to our website to register. It's easy. But if you want to register right now, you can just scan the QR code and just register. You can do it right now if you want. So this, you know, we did it last year. We got great feedback. We think we're going to keep doing it every year.
Good.
So, and that
And
this fits into our, you know, community health needs assessment theme.
Yep.
yes. And my question was about whether we were gonna get, you know, credit, whether the health department, you know, that this was kind of part of the health department activities was mentioned, and I see it says join the health department, but I mean, I think
Correct.
that's important that we kind of brand out a little bit,
Yeah.
just like
Yeah,
the
that-
other departments do. We ought to be branding out when there's things that we are helping bring to support the community.
Correct. But that's the only credit you get though, like just on the flyer. That's it.
I know. Could we have like a, could we have like a little poster next to the van or something? I'm kidding. Anyways, that's great.
All right. Next, Cassidy. All right, so the health department will be hosting a hearing clinic in conjunction with Beltone to deliver on-site hearing care to adult residents and employees. So it's just for adults, no minors invited. The company doesn't have the different set of equipment needed to test minors. So this is just for adults only. Individual screenings last about 5 minutes each. At the start, each participant would have the opportunity to take a look inside their own ears. I did this before, and I was actually able to see my own, ears. So it's a great thing. After that, there's going to be air conduction and bone conduction screenings at key frequencies. And at the end of the 5-minute screening, there will be enough information to know if the participant has hearing loss or not. If there is hearing loss, Beltone, the company, would book an appointment for a full evaluation at their office, or if you already have an audiologist you're working with, they can just fax the result to the audiologist. So you don't necessarily have to go with Beltone. You can go with whoever you're comfortable with going with.
So this is a free
Insurance,
service?
say that again, sorry.
A free service?
Pretty much, yes. Insurance is not required. Again, it's an adult-only event, and the registration link is on our website, but you can scan this QR code as we speak and register. It takes less than a minute. Very easy.
Good work.
Yes, so Beltone has been here. This is going to be their 3rd time. The first time we did it, all the slots got booked up, and they got emails to come back. Second time, we were almost at full capacity.
Nice.
This is the 3rd time, and we think it's going to be a great outcome. We know that at least between 3 and 5 people have signed up already. So it's looking good.
Right.
Fantastic.
Yes, and again, do we have the health department on here? Or just Town of Reading? Yes, we have the health department. So we get some credit.
Yep. Gotta get credit.
All right, so the health numbers. Yeah. So in January, we conducted 12 food inspections and 1 food reinspection. We conducted 2 body art inspections, 2 housing complaint inspections, and 2 solid waste complaint inspections. Let's see. Let's put the disease surveillance up, please. So in December, we had like really low numbers for COVID. And but to my surprise, when I ran the numbers from the beginning of the new year, January 1st to today, the cases, the confirmed and probable cases pretty much went up, which is consistent with what the state is experiencing at the moment. We had, so far in the new year, we've had 1 case of norovirus, calcivirus. We've had 1 case of campylobacteriosis. We've had 72 confirmed and probable cases of influenza and 77 confirmed and probable cases of coronavirus. So we continue to urge our residents to take precautions and get vaccinated if they haven't. Wash your hands regularly, cover your cough and sneezes, keep your distance. If you're around someone who's sick, wear a mask if needed, stay home when sick, the regular protocols, just do it. Let's see. A public health nurse position is still vacant. But keep looking. But things are going well at the moment,
Mm.
so we're not desperate. All right, that concludes.
Harry?
I guess you can't have anything in your numbers. I'm just curious how things are going with shared services.
Well,
Oh,
the
dear.
shared, the shared inspector resigned,
Oh,
so
no,
it's like we're back to square one.
Okay.
that
I'm
was
sorry.
the shared services inspector, not our
Correct.
own.
Not Jennifer, no.
No,
Yeah.
no, not Jen. No, no,
No.
no. I don't even want to think about that.
No,
Ugh.
don't even put that energy out there.
Yeah,
Woo.
please.
We love you, Jen. Um,
Yes.
That's too bad. Has there been progress with the intermunicipal agreement? Are things moving along on there?
Yes, the attorneys are meeting on the 15th to finalize the document and pretty much execute it.
Good.
Great.
That's exciting.
Yeah. All right, handing it over to Dr. Lopez.
Any other final comments? I want to mention just a couple things. One quickly is that we have 3 applicants for the full membership for the 2 positions for the
Oh, wonderful.
memberships for the board. Unfortunately, you know, the VAS committee hasn't scheduled a meeting as of yet, and I believe Jackie McCarthy was and Chris Haley were the 2 people on the VAS, so now that has to be repopulated. And so that's slow moving. The other thing is obviously Jackie was our liaison, as is Carlos, although Carlo doesn't, he doesn't usually attend these meetings. I don't know whether we'll be assigned another liaison or not. And then lastly, I don't know if you, and I mentioned this to Ade, I don't know if you saw in the Globe, there was this article about the opioid funds. So, you know, there have been a number of settled cases, large numbers of dollars distributed back to the states from pharmaceutical companies that made opioids. And the state then distributed those to, or allocated those to cities and towns. And so the big thing in the Globe was that apparently statewide, only 20% of these funds have been actually spent on some kind of activity related to, you know, dealing with the opioid crisis. And so there is actually on mass.gov a website that you can go and see your town and see where that stands. And so I did that, and Reading was allocated, I think it was like 98,000.
Wow.
And we have spent thus far 23,000. And so we're kind of at that 20% roughly as well. I think that this may be like an opportunity, since one of our 5 goals for the CHIP is around mental health and substance abuse, that this may be an opportunity that there's, you know, $70,000 of funds that could do something, you know, whether it's education or more Narcan training or distributing Narcan to the, you know, to the schools, or I'm not sure what, but you know, there's, you know, it was just interesting to me that there's money out there and we don't even know about it.
Yeah.
Yes, Carrie.
I saw the article too, and I am absolutely sympathetic to the perception of, you know, particularly, you know, the viewpoint of family members who had lost loved ones due to overdose and, you know, their lack of understanding. At the same time, I was, you know, a little sympathetic to communities because it's surprisingly, it's not easy to spend money. There are a few reasons, right? Particularly at taxpayer dollars, right? I always would tell my staff, I want our dollars to move slow because we need to be careful and do a good job about spending this money. And I don't want anybody, with a checkbook just saying, hey, that sounds like a great idea. Let's buy that. So there's that. So I was curious about where Reading was, because I know we have, a great substance use coalition, and we're lucky to have Erica and her staff. And I'd be interested to hear where they are in terms of the process that was laid out by the state for the things you ought to consider for how to spend the dollars, and kind of what if there are hopes and dreams attached to those other 70,000 already. I don't know if we could ask them to come speak to us if we
Just gonna
could.
say that, yeah,
I'd be open to that if others are interested,
for sure.
how that works maybe.
Yeah.
Because I mean, it's a opportunity. But then I just do have to say it's not always easy to spend the dollars, making sure you're following proper procurement rules and making sure that you're not supplanting other services and the like. So but I'd really be interested to know what the rest of the plans are,
Yeah,
and how
no, I
we
think-
might dovetail programming or not.
I think that's a good idea. I think there's this, that old saying, you don't have to reinvent the wheel. I would think that, we ought to be down the line. We're going to be looking at communities or, throughout the Commonwealth, and what are they doing and what has been successful, and just copy it. I mean, we don't have to come up with all the new ideas ourselves, right?
That's right.
Any other comments
If I
or?
can just chip in,
Please.
whoever is in charge of the money is who needs to come to the board and have a conversation with the board. So from my understanding, the town manager or the acting town manager is the one in charge of the funds. So I would talk to Matt or whoever the select board picks, if they pick somebody on Tuesday, and have that person, come to the board and talk about the funds and
Sure.
what they plan on doing with the money.
Be
Well,
great.
it could be, I don't want to get ahead of our March CHIP meeting, but I mean, if we do put together some kind of collaborative steering committee, I think what we ought to be thinking about is, for each of those 5 goals to, somehow, whether it's subcommittees or other people or agencies, or, take one of those goals and do some benchmarking and come up with some ideas, and working through a steering committee or a collaborative committee, and that would be the point at which, the goal number 5, mental health and substance abuse, they've come up with these 3 things we could do. That would be the time to say, let's tap into, these dollars and kind of.
And I believe there'll be additional dollars forthcoming. There are suits not yet settled or dollars not yet dispersed. So I think it's great to have some kind of
Plan.
thinking,
Yeah.
right?
Yeah.
Absolutely.
Thinking ahead and saying,
Yeah.
okay, what are the priorities and what might make sense? So
Right. Well, can I have a motion? I'll make a motion to adjourn. Can I have a second?
Happily,
Okay, Paula, second. Roll call, Carrie,
yes.
Paula,
yes.
Rick, yes. Thank you all for
Thank you,
a
everybody.
productive meeting.
Yes. Good
Very-
night.
Look
Thank
forward to
you.
seeing you at
Good
the Planning committee meeting.
And everybody.
All right.
Bye.
Good night.